Hello, everybody. My name is Dr. MarkAlain Dery. I'm Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health, Louisiana. I live here in New Orleans, Louisiana, and this is the day after the massive Category 4 storm that hit here in New Orleans. I'm broadcasting or filming right now from my wife's office in City Hall. She's Deputy Chief of Staff for Mayor Cantrell. Last night we spent the night here in City Hall, thankfully safe and sound, while I was answering calls last night for people with medical emergencies. A lot of people concerned due to issues regarding their oxygen and what to do with oxygen. New Orleans is without power right now. The entire city is without power. Thankfully, City Hall has power, and I'm going to be able to get this video out via Wi-Fi, which we do have here. So, I wanted to do this video. Because I think that the content is still really important, especially in light of the fact that we just got hit with a massive storm. Thankfully, no flooding, as we saw with Katrina, but this was the impacts of which right now we're still pending, and probably you guys who are watching this probably know more than I do, as we haven't been able to, I have not been able to access any news at this point. So anyway, just to continue on, as providers, we've drastically seen how the realm of public health has influenced our professional lives, whether we serve in academia and administration, research, in private practice, or in the hospital setting, or for some of us, all of the above. COVID has become synonymous with the term public health. It has dominated our dialogue over the past year and a half, and rightly so, but we all know that there are other issues that deserve attention too. So, you best know the ACOI for providing a quality of CME for physicians, both online and in person, and more than providing internal medicine CME. The ACOI has been working diligently to keep you up to date by sharing updates of the ongoing COVID-19 saga, as well as expanding our coverage to include other public health concerns. So let's get started and talk about what's on everybody's mind, and that's, of course, several storms coalescing to form a perfect storm. Of course, I live in the heart of hurricane territory, and as a public health servant in the city of New Orleans, I'm seeing the convergence of two frightening scenarios, right? First, the unending surges of COVID-19 amongst the unvaccinated, and two, as I look out to the weather forecast, we're seeing hurricanes, and again, we just got hit by Hurricane Ida. We're not even 12 hours out from it yet. I can't help but wonder how this current warning of an impending hurricane and future storms we're sure to see as the season continues will continue to foster the spread of SARS-CoV-2 virus in so many hurricane-prone areas. Last hurricane season, we heard advice from emergency officials warning residents in our low-lying coastal areas to pack their masks as they prepare to evacuate. And this year, the advice is to get vaccinated as well. The real perfect storm in Louisiana and many other southern states prone to hurricanes, unfortunately, have some of the lowest vaccination rates in the nation. Less than 50% of residents in my state, Mississippi, and Alabama are vaccinated, and our hospitals here and across the Gulf Coast are already dealing with the biggest disaster, and that's overwhelmed ICUs of COVID-19. I'm sure you're seeing new parts of your hospitals that either have never accommodated patients or that now have been turned into ICUs. For example, the University of Mississippi Medical Center has resorted to staging 2 field hospitals and parking garages, there we go, to cope. And how will that work during a hurricane is anyone's guess, and so we definitely need to follow up on that. I know the demand for healthcare after a hurricane, even during normal times, can be overwhelming, but now with overfilled ICUs and stressed ERs, it's the perfect storm that has the potential for creating a nightmare scenario. Even if people get vaccinated today, it'll be 6 weeks before they're fully vaccinated, and my guess is that we'll have many, many threatening storms from now until then. Huddling together in storm shelters and emergency centers is the perfect recipe for transmission of COVID. Last year we had hurricanes Laura and Delta, and at the time they hit, there were COVID patients in hospitals, but not the surge that we're seeing now. Louisiana was able to house evacuees in our empty New Orleans hotel rooms, which alleviated shelter congregating, and that helped to stem this virus just a bit. This year it's different. Hotels are open, in some cases they're full, so likely people are going to be sent to shelters here and in other Gulf states where we need to evacuate populations in harm's way. The real fear now is everyone knows that there's a COVID surge and resulting massive hospitalizations. People are too afraid to evacuate due to the fear of getting COVID out of shelter. And if they choose to stay home, there's, of course, the storm surge that we saw, winds and danger from the hurricanes that pose threats to their safety. That's why we can't stress enough that vaccines provide confidence evacuees need to feel when they're sheltering, as well as masks and social distancing, of course. Yet when it comes to hurricanes, the biggest stress on the health system comes after the storm. People leave homes too early and begin to clean up the damage that hazards are around. People using chainsaws when they don't usually use such equipment can lead to injuries, sometimes electrocutions. And what will hospitals do if there's a new demand for emergency services with ERs already overflowing? And some, by the way, have turned into full-fledged COVID wards. Combine all that with nursing shortages that some places like Texas are seeing, and the scenario is even more dire. In fact, COVID patients filling hospitals tend to have long stays, keeping beds for longer stretches. And as I've said before, this continues to perpetuate this perfect storm. And as healthcare providers, we need to respond and encourage individuals in hurricane-prone areas to get their first vaccine if they haven't done it already, or go out and get their second one. Do it today, now. Secondly, they need to be warned not to venture out immediately after a storm until first responders can get to and clear roadways and down power lines. Venturing out into unknown situations the first 24 hours after the storm is indeed super dangerous, and from a public health perspective are posing dual threats: COVID transmission, especially for unvaccinated, combined with the usual threats that these storms bring. And I tell my patients to get storm ready and to get vaccinated, be prepared with their evacuation kit that needs to include a mask and hand sanitizer, wear a mask whether in a shelter or staying with friends, and to find out ahead of time if the family and friends you're sheltering with are vaccinated, and wear masks. I keep repeating that. Wear masks. I also remind them of the obvious. Continue to wash your hands frequently. Also have prescription medications ready to pack if you're evacuating. Pay attention to local guidance and updated plans for evacuations and shelter, including, and please keep our pets in mind. Take them with you and find out if shelters take pets. So, thank you for letting me do this. Stay on the lookout for these updates, and to read more from the sources used in this report, you can go to acoi.org/resources, and together with the ACOI, we'll help you keep up with the latest information to help you respond to patients. Feel free to reach out to me at madery@mac.com, and as always, thank you, Gina, for a great script.